Undoubtedly, the thing I'm most proud of is the vaccination programme during COVID. It was one of the most effective and largest programmes of government in civilian times. And we went from the advice that it would take in normal times 5 to 10 years to develop a vaccine to delivering one before anybody else in the world in 11 months. There were amazing people involved in making that happen. It was a huge team effort, but it was also about galvanizing people to anticipate that we might actually come out on the best case scenario. In a time when things kept going along the worst case scenario, the challenge in the vaccination program towards the end was getting the rollout ready in case the science and the amazing regulatory work by the MHRA came out quicker than anticipated, because we knew that there'd be huge pressure the moment one was validated. Yeah. So in the end, during at the start it was largely Oxford University, and then it was the Vaccine Task Force doing their purchasing, and then it was the MHRA, all three of these led by brilliant women, and then the rollout in the NHS, also run by a brilliant woman, Emily Lawson. And so those four parts all happened about as quickly as they possibly could. But the biggest challenge towards the end was saying to millions of people who were going to help make this happen, this might all happen at the start of December. And I remember when I first put that date out there, people were incredulous. So I described it as the reasonable best case scenario to contrast it with the reasonable worst case scenario, and that's what came off. Well, yes, lots of things, of course. It was an unprecedented time. The number one thing is when the next pandemic hits, and it is a when, we need to be ready to scale a whole part of the response that simply didn't exist last time round. The testing operation is the single most important. In the early days, the contact tracing, the protective equipment, the NHS response, getting that up and running fast is vital. There's now work on to have a vaccine within 100 days. I think that's a good stretching target now, to bring it down to essentially 4 months rather than the 11 that we pulled off under COVID. That's important. But the single most important thing that we learn is what I call the doctrine we need to apply, and that's normally a military term, but it means how you engage in a battle at a strategic level. And it is that as soon as you deem a lockdown to be necessary, you need to get on the lockdown. There is no benefit from waiting. You may assess that you don't need to do it, but obviously it's great if you don't have to, and we have communicable pathogens that come into the country all the time that we don't take such drastic action in response to. But as soon as you do assess that it's going to be necessary, you should get on with it straight away, because you're either then going to have a lockdown at a low level of prevalence or a lockdown at a high level of prevalence that will probably therefore go on for longer. So that doctrine is actually the single most important thing we need to learn. If a new minister asked me for advice, the number one thing I would say is to work out your priorities early and set them out clearly, but also to know what your job is. Your job is to set the direction and get clearance from your seniors, whether that's your Secretary of State, the Prime Minister, the Chancellor, anybody who could block your plans. And then choose amongst the options for how to get from A to B, not to get down into the weeds of how to get from A to B. That is what the civil service is brilliant at, and you need to use them, because if you don't sort out the upward management, you're not going to get anything done.